What's the best way to cure hysteria according to 20th century medicine? Well, obviously, by electrocuting the brain. Nothing says mental health like a good old-fashioned jolt of electricity. Electroconvulsive therapy, or ECT, was introduced in the 1930s and became a popular treatment for all kinds of mental health issues, including hysteria. The logic? If you shock a woman's brain hard enough, maybe her pesky emotions will reset. Because clearly it's the brain's wiring that's the problem, right? Not a repressive society or anything like that. Women with hysteria, a diagnosis that can mean anything from anxiety to just not wanting to conform, were prime candidates for ECT. Doctors believe by inducing seizures with controlled electrical shocks, they could somehow reset the brain and eliminate hysteria. And for women who were labeled hysterical, this was often seen as the last resort. Early ECT treatments weren't the smooth, carefully controlled procedure we know today. Back in the day, the shocks were much more intense and anesthesia wasn't always used. Patients would experience violent convulsions, memory loss, and sometimes even fractures due to the muscle contractions during the seizures. But hey, at least they weren't hysterical anymore, if they could even remember what hysteria was after their brains got zapped. Many women who were diagnosed with hysteria, depression, or any other inconvenient emotional condition were subjected to this treatment. The thinking was that since hysteria was rooted in the brain's misfiring, electrocuting it would fix everything. Spoiler, it didn't. Eventually they realized that maybe frying someone's brain wasn't the best solution to their emotional issues. Modern ECT is still used, but it's much more controlled and targeted, and it's certainly not being used to cure hysteria anymore. ECT is a prime example of how the medical community once believed that electrocuting a woman's brain was a solution to her emotional problems. While today's version of ECT is much safer and more refined, its early use as a cure for hysteria is a dark chapter in the history of mental health treatment. Turns out shocking someone's brain doesn't quite solve everything.
In his memoir, Confessions of an Actor, Sir Laurence Olivier, Vivien Leigh's longtime husband, wrote, "The ECT treatments were designed to help alleviate her manic depression, but they had a harsh effect on her memory and mental sharpness. After her treatments, I found it difficult to see the woman I had loved so intensely in the same way. Her vibrancy seemed dulled. She would emerge dazed, subdued, lacking the spark and brilliance that had defined her both on stage and off.